How can you tell if a patient is having an ischemic stroke or hemorrhagic stroke in the NCLEX exam? Because if you can spot the difference in seconds, you can answer almost every stroke questions with confidence. Let's make it super easy, using simple comparisons, quick tips, and memory tricks that really stick. First trick, think of a water pipe. Imagine the brain as a network of pipes carrying blood. It is an ischemic stroke, the pipe gets blocked. No blood, no oxygen. In hemorrhagic stroke, the pipe bursts. Blood leaks and presses on the brain. That's it. High ischemic, blocked pipe, hemorrhagic, broken pipe. Let's review quick differences in onset. High ischemic stroke happens suddenly, but the person usually stays conscious. You will see weakness on a side, trouble speaking, or loss of vision. Usually no severe headache. But in hemorrhagic stroke, you can see the starts instantly with the worst headache ever, and the person might vomit, faint, or become rigid. Often has very high blood pressures. Easy trick. Pain equal bleed, no pain equal block. Step 1 in every NCLEX question. Ask for a CT scan. The NCLEX loves to give you questions like, a patient arrives with weakness on side of the body. What is your first action? The options usually include A. Give TPA a T-place, or B. Get a CT scan without contrast. The correct answer is always CT scan without contrast. Never give a T-place before confirming that's not bleeding. Rule: CT first, treatment second. What if it's ischemic? If the CT shows no blood, it is an ischemic stroke. Now you check if the patient can receive antiplace. Easy rules, the 4.5 rules. First, time, within 4.5 hours of symptom onset. Second, blood pressure, below 185, under 110 millimeters for mercury. Third, normal coagulation, INR less than 1.7 and platelets more than 100,000. And fourth, no bleeding or recent major surgery. The memory trick, 4 weeks for 4.5 hours, time, tension, test, and trauma. What if it's hemorrhagic? If the CT shows blood, no autoplasty. Your goal now is to stop the bleeding and protect the brain. The NCLEX key actions are control blood pressure, target around 140 millimeters for mercury systolic, stop or reverse anticoagulants if the patient takes them, monitor consciousness carefully, prepare for possible surgery or drainage if the bleeding is large. A trick: blood, stop autoplasty, stop anticoagulants. Here are some quick differences based on their cause, the symptoms, what we can see on a CT scan, the treatment for each condition, the blood pressure limits to manage, and a keyword to tell them apart. A visual trick is to picture a pipe clogged with debris, which is mean ischemic, versus a pipe bursting with water, which is mean hemorrhagic, and you will never forget again. Common NCLEX questions and how to think fast. First question: a patient receiving T-plus develops a sudden headache and vomiting. The solution is to stop the plus and immediately notify the provider, possible brain bleed. Second question: a patient with ischemic stroke confirmed 2 hours ago had the blood pressure 190 under 110. What do you do? The answer is lower blood pressure below 185 to under 110 before giving autoplasty. And question number 3. The patient reports the worst headache of their life, vomiting and a stiff neck. The answer is suspect subarachnoid hemorrhage. Do not give autoplasty. The trick: headache, but autoplasty you have to stop immediately. Here's an easy time windows to remember. Autoplasty within 4.5 hours. Mechanical thrombectomy up to 24 for selected patients. CT scan immediately, ideally within 25 minutes for arrival. Memory trick: 4.5, 24, 25. Autoplasty, thrombectomy, and CT scan. Now let's see a blood pressure control quick guide. No autoplasty given, you have to allow blood pressure up to 220, under 120, brain needs blood flow. Before autoplasty, lower to less than 185, under 110. After autoplasty, you have to keep less than 180, under 105 for the next 24 hours. If you have hemorrhagic, keep around 140 millimeters for mercury. A trick: high ischemic, let it run high. Hemorrhagic, keep it low. Now let's check the 3-step shortcut for NCLEX. First, recognize the symptoms. Headache equal hemorrhage. Weakness without pain, high ischemia. Second, do the CT scan first. Blood, stop at T place. No blood, evaluate for T place. And third, apply the time and blood pressure rules. Less than 4.5 hours and blood pressure less than 185 under 110 equal to at T place. Blood or INR, you have to be more than 1.7. There's no auto place. A golden rule: symptom, CT, and decision. And that's it. Now you can clearly tell the difference between ischemic and hemorrhagic stroke and choose the right NCLEX answer every time. Remember, don't just memorize, understand the logic. If it is pain and blood, stop. If it is blood and time, treat. If this review helped you, join our community of Enfermeras en USA, save and share this video, and follow on our platforms for more simple, practical NCLEX lessons that really work. You got this, and your NCLEX success is one step closer.